Hi guys, welcome back to another video. It's your girl Martha France. Welcome back to All Things Nursing, where I talk about study tips. I take you on my journey of nursing school and everything in between in my nursing world. So I am fourth year student, final year nursing student, and I'm grateful for that. I've pushed, it's not easy. And there's something that I've been wanting to talk about, which is today's sit down. It's sort of like a story time, or so not really a story time. I want to address something. Uh, I want to address the bullying. I want to address the toxicity. I want to address the negativity that is thrown to us as students. I mean, why? I've gone through first year, I've gone through second year, I've gone through third year, and I'm going through fourth year. Can somebody just explain to me or let me know why is it that fellow nurses are rude to us? Fellow doctors are rude to us. I mean, they went through the same process we're going through. So I thought perhaps they'll be able to understand, that okay, students, they deal with so much. I've gone through this. I mean, but the toxicity, I mean, like it's too much. It's overwhelming. Do you get what I'm saying? I mean, why not show me grace? Why not show me? I mean, I don't know. That's why I'm a student. I'm learning. I'm going through this process to learn, to know my interventions, to know everything, to prepare me to be that qualified nurse. And you get to a hospital and you find the most rudest nurses that don't even have time to help students. They don't even have time to, I mean, they don't even care about you. Sometimes you just want the nurse to explain a procedure to you or something, or you perhaps don't understand what that patient has and stuff like that, because you learn as you go. You can't consume so much in class and you feel like you remember it all at once. No, I mean, you learn as you go. And why can't we create an environment that, is welcoming, is motivational? It's a space where I can express myself and not feel scared that this nurse will shout at me, this nurse will be rude at me, this nurse will ask me why am I even in nursing school, or this nurse will be so rude towards me. Do you get what I'm saying? I mean, why can't we create an environment where it encourages you know it encourages you to make a mistake and learn from it. It encourages you to, I mean, we're different types of learners, we're different types of people. The way we consume information is very much different. Learner A easily learns in class, then on clinical placement. And then so learner B easily learns on clinical placement than in class. How do I mean? There are learners that first see things physically. Perhaps when I see how a cannula is put up and then I try it, it sticks in my brain, then I know. Then perhaps learning it in class in theory that, oh, this is step one of a cannula, or this is how you prepare and this is how you do it. So some learners learn easily by looking at things and then doing it practically, and learning from it. While some learners, they learn by hearing things first and then coming to, or reading things first and then coming to put into practice what they've read. So there are different type of people. And I just feel like if you are a nurse out there, you look over students, or you're a mentor, or even you don't need to be a mentor, as long as you're a nurse and you're in hospitals and there's students in your department that are sent there to come and do the clinical rotation. I feel like be a great role model, be a great example, because I mean, you are the people that we need to help shape us. I mean, you've gone through this journey, and we may make mistakes, and that's okay. I feel like, because we are still in the process of learning and correcting those mistakes before we get qualified. So I feel like, please show us grace, and let's stop the bullying, let's stop the bringing us down. I mean, even if I failed to put up an IV line 3 or 5 times, that's okay, as long as I'm not giving up. And as long as you tell me, okay, come here, Franz, or come here, Martha, let me show you how to do it. Let me show you how to, locate the vein, or let me show you how it is to tie your tourniquet, whatever. It can be the simplest things, like how do you tell a patient bad news? How do you tell a patient's family members? How do you cope with death? How do you cope with, an overwhelming ward, because in as much as I'm a student, I'm seeing these things firsthand. How do I deal with a patient dying? How do I deal with, you know, um, a motor vehicle accident, and then there's so many people coming in that are injured and everything in the in the ward. So I feel like it's your responsibility, as a nurse, as a qualified nurse, to really uplift the students that are coming to your ward. Let's not bully them. Let's not, why am I saying let's not? Because I'm also a student. I mean, please, encourage us, don't discourage us, and be graceful towards us, because you have also been through this process. You have also been through this. And yeah, guys, I mean, please comment below, what are some of the experiences you've had, during your clinical placements, because some nurses are really, really rude. Some nurses, you're just like, wow, where's the love? How are you even a nurse if you're not compassionate, if you're not empathetic? I mean, like, it don't make sense, because I feel like nurses are one of the people that are really, really loving. The fact that you can take care of people, the fact that you can, feed a patient, bathe a patient, make their bed, just sometimes just even talk to them and everything when they're scared. The fact that a nurse can do that, I feel like it comes from the heart. And it comes from the heart, and you're just someone loving. But I also have a word for my fellow students out there. Let's not be rude, let's approach our nurses with respect. Let us, ask when we don't know. Let us not pretend that we know everything, because if you knew everything, why are you still in school? They would have just graduated you, and you skip first year, second year, and then boom, you just graduate. So don't think you know everything. And observe and ask questions. Observe and ask questions, and always have a notebook to write things down. If you're not sure, ask. Perhaps you've forgotten what is the normal value of blood pressure, and then this patient, you did blood pressure, and then this patient's vitals or values seem to be a little bit, you're not even sure, you don't understand them. So go and ask, then rather noting down in a patient's file, and then at the end of the day you do a mistake, or at the end of the day you're acting all that you know everything and all that. Be humble. Let's be humble, my fellow students, and let's learn as we go. Ask questions, be involved. Nursing rounds, be involved. Doctors rounds, be involved. Get to know your patients. When you're allocated a patient, get to know them. Go home, read about the disease, read about the nursing interventions, read about how do you care for this patient. And then when you get back to work the following day, you are a little bit, should I say, you're having an upper hand, because you're well informed, because you've done your research, because you've done whatever it is that you gotta do. Let's not be ignorant, because I feel like respect goes two ways. If we approach our nurses with rudeness, if we approach our nurses with a bossy attitude, get what I'm saying, that I got this, I know, I'm finally, you can't tell me nothing. Girl, you better shut up and learn, because exams are coming, because there's so many things. Everything is approached differently. Every patient has a different and specific needs and interventions. So let's learn on the go, and don't think, or don't how should I say, don't look down on old nurses. Trust me, them old nurses, they know this stuff. Them old nurses have so much experience, and so many, they've encountered so much, that they can give you so much wisdom. They can give you, so much on how to go about it. And just because you've learned it in class, I know you've learned it in class, but shush and just let the nurse do what they gotta do. And then you ask, oh, nurse, why did you do this? How come we didn't use this method? And then they'll be able to explain to you. Perhaps they even had tried that method that you know already, but it failed the patient. So they came up with another intervention. Do you get what I'm saying? So don't look down on them, all nurses. Don't look down on them. And let's be respectful. Let's show each other some love and care. Let's stop the toxicity. Let's stop the bullying, because at the end of the day, we all nurses. It's just that one is already qualified and the rest of us are students, but we'll eventually all get through that process. And yeah, I hope this video was helpful. I hope this video was encouraging. It's all about spreading love. It's all about loving nursing. It's all about patient care. And I'll see you guys in my next video. Toodles!